Good morning, everyone. I'm just the day after my treatment, my stem cell, and I would say that it started to hurt a little bit. I can walk, I'm okay, but it's yesterday I felt like super good. I was like, "Hey, amazing, nothing happened. That's amazing." But this morning it's like I feel like swelling. So not bad. I'm pretty happy if it's just like that, but. So I'm going to go back today to the clinic and to have another type of treatment. I'll have like a full IV stem cell infusion. It's going to take 1 hour and 1.5 hours. And I'm super excited about that. And I'll let you know how it goes. Stay tuned. Getting ready to go to Costa Rica tonight for my stem cell therapy. It's going to be mind-blowing. So I'm super stoked to see the process. I'm going to go over there to have my stem cell therapy on my left knee in order to resolve my meniscus tear. So we're in the snow right now. I'm from Canada. I'm going to fly to Costa Rica and I'll keep you posted on the next actions and on the next step. All right. I'm getting ready for my stem cell therapy this morning. I landed yesterday pretty late, around 1 a.m. And phenomenal. The service of the clinic, RMI, is just off the chart. They had a driver to pick me up. They have like a coordinator to organize all the travel. I'm in a beautiful hotel right now in Costa Rica. So super stoked, super excited. Today's the day. So really looking forward to see how this meniscus tear will be healed. So today we're going to do a tour of the Costa Rica RMI clinic with Dr. Marcelo Gonzalez.
Yes.
All right, let's check this out.
We have in these 3 rooms plasma machine. Cafeteria is down here. So with the ultrasound machine there,
okay,
that's where it starts. And then we go into the procedure room, which is this one right here. And then you end up at the recovery room right over there. Okay, so the idea is for us to start the procedure room.
Okay.
The recovery room is right after that door. Okay, so this is the procedure room. Our anesthesiologist is over there. We have the surgery table. There's a big screen for us to take a look at the ultrasound. It's just way more comfortable, and we try to do everything sterilized.
So we're not allowed to film in that place.
Okay, no, yeah. During the treatment in that one, yeah, we're not allowed.
Okay. And so you said that the first thing is that we do first the ultrasound to see
exactly. So that one's gonna be right here.
Okay.
So this one we will be able to film everything,
sure,
no problem. Okay.
Sure.
Over here, you're gonna be right here, and I'm gonna be showing you a lot about ultrasound.
Yeah.
We like our patients to see what we're seeing, understand a little of why we're gonna be putting the cells where we're gonna be
putting.
But
do you do it for us, like for me, or you do it for you also to know where?
Okay, yeah, both. Okay, so the ultrasound I could do it in 3 minutes.
Okay.
I can be done. Okay.
Sure.
But we're gonna take around 15 minutes, 20 minutes to take a look at everything. Exactly. Yeah. Exactly. Sure. To show you a little, to show you what I'm seeing, and so you understand a little bit of what we're doing.
And what's the main difference between like an MRI and like the ultrasound? Do you see the same thing, or you see different?
Okay. No. So there's 3 different lines that we usually. The most common 3 different lines for the diagnosis are CTs and X-rays, which is just radiation. Okay, that one we usually use to see hard stuff. We use it for other things, but mainly hard tissues. Okay. There's MRIs, which what they do pretty much is light up electrons. Okay, things that have a lot of electrons are usually water. Okay, so the softest tissues, the ones with more water, are going to be the ones that light up the most. Okay.
And so MRI, they go through bones, or they
MRI,
go around the bone?
No, you can see the bone, because the bone is not just a column. It's not just a dry structure. It does have a little bit of water. It doesn't light up the same as cartilage or as a spleen or liver would do, but it does have a little bit of water, so it will light up, and we would see some of the characteristics. Actually, we use it a bunch for arthritis and for our arthritis treatments to determine where the bone is inflamed. Usually when there's arthritis, the bone has been bumping against each other, and that bone gets inflamed. Sure. So that's where we point into the bone injections as well to get rid of that inflammation. In the ultrasound, it's not ideal to see meniscus, but it will guide me during the treatment. I won't be able to see the whole meniscus. I'm just going to be able to pinpoint where the injury should be regarding the MRI and try to put the needle directly where it should be. Okay.
And when you saw my MRI, I don't know if you remember, but is it? Do you remember?
Yeah.
Like, is it a small tear, medium, big, or is it a tear, or it's something else?
It's well, yeah. Okay, so imagine the meniscus being like a patty, okay,
Sure.
like a beef patty, okay, and the patty got pretty much torn down here in the middle, okay. So you grab the knife and you just tore it down, okay. So it's open a little bit like that, okay. When tears get bigger than that, this flap could go all the way here, okay. It still hasn't happened. Nothing like that has happened. It's just a tear that's gotten a little bit separated, okay. So the idea is to go pretty much with the needle, go inside there directly.
In the meniscus?
Exactly, yeah.
Okay,
correct.
Okay.
Yeah, into the tear and put a little bit there, okay. I'm gonna put in 2 spots since it's a sort of a long tear, and I'm gonna be going into the knee as well, into the whole joint. Okay, so that's the general. First, we have over here, this is where the VO2 max and the Vizia are.
Nice.
Here are 2 of our other doctors right here.
See you.
Yes, sir.
And this is Dr. Lu, this is Dr. Deligiore. And so, yeah, Dr. Lu is the skin doctor.
The idea is you're measuring your VO2 max is the best way to measure your longevity, basically. Right now, the strongest predictors, according to science, are your VO2 max and your muscle mass.
How would you test the muscle strength?
So we use the dynamometer, which this one is really easy. So just relax. Right?
Okay, like this?
Yes, exactly.
So if I do it like that, it's
doesn't really matter. Okay, 1, 2, whatever you want. Okay. Okay, perfect. So you got 64 kilograms of grip strength.
Is it good?
It's better than the doctors. So
Better than the doctor.
You're even above it. So that's great.
Okay.
And those tables change sort of as you age, so that's something you gotta sure. But yeah, actually, like my grip strength is not that good ones. Let me show you.
Well, you have big arm, you know. You should.
Yeah, sure. Yeah, but see, I barely get to 50.
So that's crazy. How come like you have bigger arm than me? And so why is that? Like because the strength is not the muscle.
Couple of reasons. Yes, but think about it. Olympic weightlifters can be really, really strong, but they're not as huge as Mr. Olympia. So muscle strength correlates to muscle size to a certain degree.
Okay.
There's a certain amount of strength you're gonna be able to make to produce with a certain amount of muscle mass up to a certain point.
Okay.
But strength is more a neuromuscular.
Neuromuscular, you mean like the nerve system?
The connection between the nerves and the ability to recruit muscle fibers does not necessarily mean you have more muscle fibers. Or larger, for example. So that's why the strongest people in the world aren't necessarily the largest.
But the thing I really want to acknowledge is like your professionalism. Like from the way I sent out my form requests for information, like every step of the way was like super well handled by
thank you.
By every person of your team, you know, and that was like super important for me, and that was one of the key decision factor why I decided to come here.
Oh, thank you. Yeah, we tried really hard for that. Yeah, we tried really hard.
No, you do an amazing job. You know, I mean, you say that you're a world-class place, and you are. I mean, that's. I mean, so far so good. I mean, right now I'm really amazed. So,
thank you.
You know, so I mean, it's the first place where like I sent in my MRI. You guys took the time, no charge, to analyze it, to show me my knee and to like see, okay, will it do a difference? And then after like to organize the trip to, you know, you have your, I don't know how you call that, like the experience,
the patient experience.
Patient experience.
Yeah, the whole patient
That's amazing,
experience.
you know? Because it can be scary for some people, like to go to Costa Rica, they don't know where to go. But I mean, it's really like your white glove service. So
yeah,
good job.
We know.
I say good job to you, but I say good job to the whole team. So I mean, that's
we know that patients are not only getting a treatment that they don't know much about, but they're also coming to a country they don't know anything about, probably. So we try to make it as comfortable as possible and to make it as sure as possible.
Yeah, that's amazing.
And the thing that we really don't like is for patients to come here and for a disease that we're not able to treat. Okay, so we would like to make sure before a patient pays or before a patient does anything that we actually can help it.
Yeah, and it's you know, it's not cheap. It's a big investment, but I think our health is the #1 priority, so it's worth the investment. So cool. All right, let's continue.
The knees 2 bones, okay? The lower bone is the one that has the meniscus attached, okay? So it's like a big plate, like that. Okay. Both meniscus are like half moons,
Mm-hmm.
right? Like croissants.
Yep.
Okay, pretty much. They are only attached here, 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 and here. Okay. Along this side, they do have a little bit of attachment, but they're pretty much free. Okay.
They're floating or
Exactly.
okay.
So we stock up a paper down there. Exactly. That's where the flap would have happened. Okay. So the idea is to get with the needle right there and right there.
Mm-hmm.
Okay.
Mm-hmm.
So those are the meniscus.
So now we clearly see like the white line. How are you feeling? I feel good. So I don't know what I'm going to do right now. So basically, I had two choices. Either I do like the full anesthesia, where probably I would be harder and like waiting for that. But I decided to do local anesthesia. So we'll see. We'll see how hurting it will be. So I'll breathe. I'll think about beautiful things. And looks like they have extra cells, so they're amazing. They're gonna do so probably 80% of the cell in my left knee, which is I have a meniscus tear. And from the ultrasound, we kind of saw that maybe I have also another tear on my right one. So we're gonna put some extra there.
Today you're going to receive a stem cell infusion. This is an allogenic stem cell infusion, which means that it comes from someone else, which is not yourself. And in this case, they come from umbilical cord. Okay.
Is it the same thing that I had basically in my knee?
Yeah, same type of stem cell.
Okay.
Thing is that this way we're going to do it intravenous.
Mm-hmm.
Okay. So we're going to dilute the cells in Ringer's lactate, which is the solution right here. It's a very rich solution. And also we're going to do a very slow. It's usually done in around an hour and a half. So the reason why we take this time is to prevent any type of allergic reactions and adverse reactions. Okay, so one of the main things that we take into account here is not only the timing, but also we look first to your vital signs, making sure that you're ready to go. Then we're going to take your IV. And once we're done with that, you're going to see how we show you the syringe with the stem cells. We're going to make sure it's the amount that we're going to serve you, which are 100 million stem cells.
Okay.
We dilute them right here, and then we begin with your infusion.
Okay. And I'm curious, so what are the main benefits that we should expect from this type of infusion?
Okay, so stem cells are known to be able to develop certain substances on their own. Some of them are anti-inflammatory cytokines. So they have what we call immunomodulatory effects. So they help in a way modulate our immune system, and that helps us diminish the levels of inflammation that we have in our body as a whole. So that can help us in many areas. Even patients, we've had some of them tell us that they improve their sleeping patterns. They even feel more energy in their day-to-day and feeling.
It's gonna go everywhere in my body, or I think yesterday someone told me it's going more to my
Usually,
my heart and my somewhere else. Where
because of the size of the stem cell, a large amount of those they get they trapped in your lungs in a way, right, in that area. So you do have a great benefit in that organ, and there they are able to secrete a lot of substances that, as a whole, they go through your body. So this anti-inflammatory properties is one of the things that you can benefit as a whole. In general,
and
yes.
does it stay a long time in our body, or it flushes it out after a couple of days, months, a year, or what's the internally what's doing exactly?
So usually what is described in literature is around a month to see the effects of the substances that they secrete. It can be experienced up to 3 months, and there's a period of like 3 more months to be even noticing some of the benefits there. After 6 months, there's not much evidence to tell us that there's a certain effect for that other 6 months to be able to call it a year. So there's patients that can get it every year, every 6 months, and that's even okay.
Okay. Yeah. All right. So I'm at my second day here at RMI. Yesterday I had my knee stem cell injection. Now I can feel like it's a little bit more swelling, but doctor tell me every 2 days the worst day, and I'm smiling, I'm having fun, so I guess it's not too bad. So I'm very excited to see the result of the IV injection.
Things you can expect, it's maybe to feel a little sleepless for the first night.
Okay, does it mean no sleep, or?
It's not like insomnia. What we usually see patients refer is that they feel like they don't want to sleep.
It's perfect.
They just feel very...
Like at 3 a.m.
So if you have to work, then get your things ready so you can work up in the night, and
Cool. Amazing. All right. My pressure okay.
Blood pressure is fine. Sometimes there's some things that can make our blood pressure seem to be a little higher. Sometimes when we cross our legs, when we're talking, when we get our blood pressure measured, so those things can increase. Usually the systolic pressure is what we see a little bit increase, which was your case. That viability, the lab has done a lot of trials with their yields. Don't extend that time frame. That's why we do.
I confirmed yesterday around 5 o'clock. So I mean, were they freeze yesterday? And
Yep, they
this
usually
morning they unfreeze now, or
not this morning. They actually do it in different periods. Sometimes twice in the morning, twice in the afternoon, depending on how the patients are scheduled.
Good. So one of an amazing thing that they have at RMI in Costa Rica is that they have their own lab, basically, where they culture the cell and they expand it. And everything that we put in our body is really fresh. So they just confirmed me that basically 20 minutes ago, they removed the cell from the lab, bring it here so I can have the infusion ready for that.
So the plasma exchange is done with an apheresis machine. With the same machine, we do the collection.
This is your name?
It is.
Okay. This is your birthday?
Okay.
It's usually not risky adverse events, as I was telling you, but we want you to be comfortable during the whole procedure.
Everybody is super nice here. I mean, so thank you very much.
You're very welcome. Yeah, we want our patients to be as comfortable as possible. Always.
Okay. Are you ready?
Of course.
Science, regenerative medicine, it's not necessarily very new because it's been researching for.
Yeah, but it's newer for general public, I would say.
Correct.
All right, so the process just started. So I have 1 hour relaxing. I can chill out. I can read. I can do whatever I want. So I'm in great company right now. And so we'll see you in 1 hour.
okay, so it's been an hour and it's done. I've done it. They put some warm, what do you call that?
Blanket.
The warm blanket, and I feel so much better. So I was shaking like crazy for a moment, but after that, that was all good. So yeah, so the process was pretty streamlined, and now they're taking some pressure to make sure I'm good, remove some stuff, and ready to go home. So thank you. So I just took like a glass of water, and boom, my body started to shake like crazy. So thanks for the blanket. And it's funny, like I just asked to do a video and like I was shaking like crazy, and now I'm doing the video, I'm not shaking. So that's it. So yeah, so that's part of the process. It looks like it's normal to do. And wow, now like the blanket make a huge difference. Truly, like I feel like perfect. So never do IV stem cell in flip-flop. bring your socks and yeah, warm clothes. Stay tuned.